Dr. Alex Schupper is an intern in the neurosurgery residency program at Mount Sinai. He received his bachelor's degree at Johns Hopkins University, where he double majored in neuroscience and biology and played varsity baseball. He also served as executive vice president of the Student Government Association his senior year. Alex earned his medical degree from the University of California, San Diego School of Medicine. Right now, Alex is working in the COVID ICU at the Mount Sinai Hospital. He has found himself taking on tasks and responsibilities normally assigned to second and third year residents and working in intensive care in an area outside his comfort zone in neurosurgery.
What is your usual role within Mount Sinai? What have you been assigned to do during the COVID-19 crisis?
So as an intern in the neurosurgery department at Mount Sinai, your clinical duties are split between Elmhurst Hospital Center and Mount Sinai Hospital, working in the neuro ICU. Currently, our current curriculum is that you spend 6 months within the Elmhurst Hospital Center neurosurgery department as the junior resident on the service, and then 3 months as the neurosurgery intern on the neurosciences ICU rotation. As of now, obviously everything has changed. We kind of have an all hands on deck deployment where we're all now centered for the most part at Mount Sinai Hospital, except for a couple of residents at Elmhurst and a couple of residents at Mount Sinai West. And intern now, our roles are split between working at Elmhurst as we normally would and working on the neurosurgery service essentially as a junior resident. So right now I'm working as the intern on the neurosurgery team at Mount Sinai Hospital, where we take call as regular junior residents do, and essentially filling a currently PGY 2 or 3 role as a PGY 1. First, it's a little overwhelming because you're getting kind of thrown to the fire in a role that you would normally be performing as a 2 or 3. Now you're performing that role as an intern. So there's a steep learning curve, but we have a great group of residents. Everyone's been really supportive, and everyone's kind of taking me under their wing and showing me the ropes. And I'm definitely never alone out there. I always have my higher ups who I can go to, and we always have multiple people in the hospital 24 hours a day. So we really have that supportive team camaraderie at all times, which is really nice and really helps the learning curve.
What sort of new skills have you had to acquire to do your new responsibilities? How did you prepare?
Right. No, I think I speak for everyone when I say that we're getting acclimated very quickly to our new roles. Even just last week, I was working in the neuro ICU, working as basically the senior resident who was there overnight, which is a daunting task for a first-year surgical resident. But you learn things very quickly. People like Leslie and Dr. Betterson have provided us with material on, basically an acute crash course on critical care management. How to work ventilators, how to take care of critical care patients. And I think we're all learning on the fly. Even though we get some experience during our intern year, it's in a very focused setting of you're just taking care of neurocritical care patients. And you can kind of leave the non-neuro side of critical care management to the other folks on the critical care staff, like the ICU fellows, the attendings, et cetera, the APPs as well. But when you're the only person there, you have to be responsible for all facets of their management. So we're learning all this very quickly. The attendings are working in our KCC9 neuro ICU COVID unit, and many of them haven't practiced critical care medicine in years, if not decades. So I think for them, it's an adjustment as well. We're all learning or relearning critical care management, and we're just going by the seat of our pants and trying to take care of patients the best we can.
Can you describe what your new day-to-day life is like? How many days and hours are you working each week?
The schedules are constantly in flux because our roles as neurosurgery residents are changing almost every day. For example, last week I was working in the neuro ICU with several other junior residents with oversight from one of our chief residents. However, this upcoming week, we've totally switched the schedule around, and now I'm going to be taking call on the neurosurgery service, and the PGY 2s and 3s are going to be in the ICU. As more non-neurosurgical ICU patients are going to be filling up our beds, they're switching around the complement of residents, to better suit that. And in exchange, I'll be taking primary neurosurgery call and not working as closely in the ICU. So things are changing every day as of now. This is going to be our schedule, but things are very rapidly switching. So really, it's, running the gamut. It doesn't matter if the patient is infected with coronavirus or not. We take care of them. We treat all the patients all the same. Obviously, their severity of illness depends if they are infected or not, and that usually supersedes their neurological condition in this, current setting. But we take care of all of them, whether they're in the emergency department, if they need to go for emergent surgery, if they're on the floor, if they're in the ICU, it doesn't matter. We take care of any patient with a neurosurgical disease.
What's it like in your unit now? Can you describe the environment? What's the feeling among staff? What are the protocols you need to follow that are new? Describe what you've been seeing.
I think, as expected, there's a certain heightened level of anxiety, of vigilance that goes with everything. Everyone definitely has a microscope on everything going on. Anyone who comes in and out of the unit, they're washing their hands. People are very religious as they need to be about washing their hands and personal hygiene. We all really look out for each other and making sure that everyone is always wearing a hat, mask. They have eye protection if they're going into any COVID rooms, that every surface is being regularly cleaned. It's a very high attention to detail in terms of hygiene of our unit, of ourselves, of our patients. So I would say just overall a generalized heightened sense of vigilance. But with that comes some anxiety, because we're privy of what's going on around us. We know that we're in the middle of all this, and we see the numbers, and we know that we're right in the thick of it, and we haven't gone over the apex yet. So until then, we need to maintain this heightened level of awareness, like you said, to protect ourselves, but also to protect our patients. Because the last thing we want to do is propagate this virus throughout our hospital, and we want to contain it and not, have the opposite effect.
How has your role in the neurosurgery department prepared you for this new role?
Obviously, I'm extremely biased, but I think being a neurosurgery resident really prepares you for a role like this. Ian McNeil, one of our chief residents, gave a great speech to our residents this morning where he said, that we have more resilience and more willpower than pretty much anyone else in terms of medical training. And we're here for a reason, and we fought, an uphill battle to get to being a neurosurgery resident. And we're the people who need to embody this role of this, seemingly forever changing role where we're put out of our comfort zone in roles that we didn't sign up for. But just having that resilience and that willpower is what, epitomes of a neurosurgery resident. And, there's no better way to show that than to work in this setting and to be adaptable and to be resilient and to be able to take care of any patients that we need to take care of, whether they're neurological patients or not, that we know that we can do it because we're confident in our skills and we know our abilities and we're able to take on any task that's given to us. So this is just another example of how we're going to rise to the occasion and work together as a team to take care of all these patients.
Have you had any interactions with patients or their families you'd like to share? What about interactions with colleagues that you'd like to share?
Yeah, I think we're all pretty deep into it. And we all have our own intimate experiences with it. Every day, all of us are taking care of COVID patients. So we're all very close to it. I think some sources of inspiration that I found in the past couple of weeks are especially our neuro ICU staff, our attendings, our APPs, our fellows. So everyone has really risen to the occasion, and they really have taken on a Goliath in this. And for example, Neha Dingai and Cappy Lay, our co-directors of our neuro ICU, have really stepped up to the plate, and it's incredible what they're doing. And the fact that they have mid-20s patients in an 18-bed unit is incredible. And these are all really, really critically ill patients. And, they're surrounded by nurses who are overworked and overrun. And it's all, emotionally challenging for all of them. But I think the leadership that, Alex and Kate and Neha and Cappy have shown is truly incredible. And it's really, it's moving for all of us to see that we all want to rise to that occasion with them. And they've been incredible leaders from the start. And it really is inspiring to have them in our department and lead the push to tackling this virus.
The coronavirus is scary. Everyone has a certain level of fear about what might happen to them if they get sick. How are you feeling? How have these feelings influenced your work?
I'm feeling good, both physically and emotionally and mentally. I'm feeling well. I think everyone, like I said earlier, has a heightened sense of anxiety with it because we want to focus on our job at hand, but we also want to keep in mind the bigger picture and where we've been, where we are currently, and where we're going. I think it's good to keep that in mind and keep that insight. Just as far as what the next couple days, couple weeks, couple months look like, and how we can expect that to affect our lives, our families' lives, etc. But no, I think, like I said, I think it's good to have a perspective on things, but a lot of us are running on autopilot that we try not to think too much about it. At the end of the day, we're doctors. We're here to take care of patients. Doesn't matter what illness they have or what's going on. We're going to go into work every day and take care of them because that's our job. And that's, the profession we set out to do. And, it doesn't change if all your patients are healthy or if they have a terrible illness. So it doesn't change what we do every day. And, I think it's natural to have some elements of fear, but it doesn't change the job that we do. And it shouldn't compromise the care that we deliver to our patients.
What has impacted you the most emotionally?
I think seeing people close to our community being affected has played a pretty big role on me. Seeing multiple neurosurgeons being severely infected by this, and a couple who have died, unfortunately. Several big players in the field of neurosurgery worldwide have unfortunately fallen ill and have died due to this illness. And so I think that it takes everyone aback a little bit to see that. And it's very humbling. It's very sobering. At the end of the day, we're all human beings, and this virus doesn't play favorites. It can, have an effect on everyone. So it's more of a reason just to be safe, be extra cautious, and, to make sure we're taking care of ourselves so that at the end of the day, we can take care of patients because we need to be there for them, and if we're not taking care of ourselves, we can't do that.
Are you doing anything outside of work to help you power through this? How about sleep, exercise, reading, meditation, cooking, touching base with your family and friends? What are you doing at home to help you make it through the day?
I think that's definitely one of the big challenges is a lot of our hobbies are taken away from us, both from a schedule standpoint of we're all working a lot, but at the same time, we can't go anywhere. We can't do a lot of the things that we enjoy doing. I love doing CrossFit and working out, and obviously CrossFit gyms are closed. Gyms all over are closed, which makes it a little bit more challenging. So we've had to be a little bit more creative. Fortunately, I have a fellow CrossFitter in Schupper who's been advocating for home workouts in our department, which has been great. It's been challenging, but I'm trying to do my best at home to stay in shape, stay mentally sane. I'm very fortunate to have my life filled with family and friends who I'm very close to, who I stay in regular contact with. And fortunately, this is all going on in the 21st century where we all have access to technology and social media, how we can all connect to each other very easily. So if there is one saving grace in the situation, it's definitely that everyone's just a phone call away. So if I need to talk to my parents or my friends or family, it's very easy to do so. So it's nice to be able to tap in with anyone in a moment's notice, and it's things like that, as well as pursuing my hobbies to the best of my ability that keep me grounded, keep me sane, and just, taking care of myself in general and making sure I'm eating right, I'm getting enough sleep, and, that I'm in a good emotional place to be able to go to work every day and do my job to the best of my ability.
I'd like to know how you're handling your personal life with your loved ones during this crisis. Are you living separately from your family? Is your family living separately from you?
I think we both have a heightened sense of vigilance. We always wash our hands when we come back into the apartment. If I'm coming back from the hospital, I never wear my scrubs home, and I take my street clothes off as soon as I get in the apartment and jump right in the shower and wash my hands and just make sure that any exposure from the hospital is not coming into my apartment. And, anytime I'm outside of our apartment, I wear a mask, and it's mostly just to protect other people. I'm pretty confident that I've been infected several weeks ago. At the time, I wasn't able to get tested, but based on my symptomatology, I'm pretty confident that I had the virus, and I'm pretty confident my girlfriend is as well. So just by proximity. And so we're trying to be careful. We're not really spending time with other people. I'm not having her go home with my family and to spend time with my family, even though that was previously an option, just because she's been exposed to me. And obviously I have a heightened exposure to a lot of infected people. So we're just trying to do the best we can to social distance and stay, do our part, which, obviously we advocate for everyone else to do, but especially people working in healthcare is extremely important not to expose yourself to more people than you need to. And just trying to do our part with keeping ourselves healthy and limiting our contact to other people.
What would you like other people to know about what you are experiencing and what we are experiencing taking care of this crisis?
I think it's hard not to get frustrated between the political climate, between what's going on, the lack of resources, and all the outcries for help that seem to be unheard, especially coming from Elmhurst, where I was 2 weeks ago, seeing a healthcare center that's so under-resourced, that's so in need, that truly is the epicenter of our epicenter. And it's very frustrating, and it's hard not to get emotional when you're actually within the walls and you see how many people are ill and how they're just so under-resourced. And it's really hard. It's very challenging, and it's hard to not feel helpless in a situation like that, to know that the resources are out there, but they're not reaching their destination. And so it's really hard to be a healthcare worker in New York. More than anything, it's a privilege right now, truly. I know that it sounds a little weird to say that, but it truly is a privilege to live here, to work in a great city. And it makes you want to rise to the occasion, to be where the sick are. And this is why we went into this field, right? To take care of sick people before anything else. And it doesn't matter if you're a neurosurgeon or an emergency medicine doctor or an ophthalmologist. At the end of the day, we're all here to take care of people who are ill. And there's no better cause that embodies this than a global pandemic. So even though it's unfortunate that it's affected New York the way that it has, it is a privilege to be on the front lines and to be able to take care of these patients.
Do you think your life will change in long-term ways because of this crisis? How do you think healthcare is going to change?
I think so. I think when anything like this happens, it definitely heightens the global census and leads to increased preparedness. For example, before 9/11, we didn't really have much in terms of airport security, right? And, checking someone's bags wasn't really a common thing. However, after 9/11, TSA became a huge deal, and airport security and security just traveling, whether you're going on a train or a bus or an airplane, became very commonplace. And I think something similar will happen here, that attention to personal hygiene and, hopefully respect for healthcare workers and healthcare systems will go much further, especially in terms of disaster preparedness. I think people will take things a lot more seriously. I know obviously things change with the political climate, but I think just in general, when it's during your lifetime and your generation that you're right in the midst of things and you see things and you're part of something like coronavirus, I think it has a very profound effect on your life and your community. And I think communities tend to rise to the occasion and tend to meet those needs, whether it's hospitals will be better staffed with ventilators, with providers who can provide immediate care for those in need, so that the next time, God forbid, something like this happens, it's met with a much greater force, and it doesn't take longer to have the heightened preparedness that you really need, and you won't feel like you're chasing it rather than meeting it head on. So my hope is that New York City and America and the world in general will rise to the occasion the next time that something like this happens. It'll be met with a much stronger prepared force.
When the worst part of this crisis is over, what's one of the first things you want to do?
more than anything, I'll be excited to see my family and friends. I think it's been really hard not to leave New York City, not to leave the state. Unfortunately, my family and people close to me have had to miss, weddings and important celebrations, and a lot of important life events have been put on pause because of all this. And I think we'll all look forward to going back to the status quo and reconvening as a community, and especially within me personally, seeing my family and friends and just reconnecting with everyone, I think in person will be really nice and really appreciated. And I think it's something that before all this, we all took for granted. And, now that we're all constrained in our little bubbles, it'll be nice once that's finally lifted, hopefully soon.